My name's Lynn.
All right. How you feeling today, Lynn?
Yeah, I'm feeling good.
All right. So, Lynn, can you tell us what do you do for work? What is your profession?
So I'm a Neuro Paediatric Physiotherapist.
Nice.
Newly qualified. So yeah, I've been qualified for like 9 months, I think, 10 months. Yeah.
And where are you from originally?
So I'm originally from Ghana.
Okay. And how long have you been in the UK?
I was born here, so yeah.
Already, yeah.
Forever.
And did you study as well in the UK as well?
Yes, I studied here, yeah. Studied and worked.
What's the life of a neuropediatric physio? What does that look like?
So as a neuropediatric physio, I basically treat and assess children with neurological conditions. So that'll be brain conditions that affect their motor and sort of their cognitive issues as well. So I do a lot of equipment, postural management, seating, treatment plans. So we do rehab for children that have had orthopedic intervention. So for children that have got tone or spasticity. So we do a lot of rehab and a lot of treatment for like tone management and orthopedic intervention.
Would you say the job you do at the moment, is it difficult? Would you say is it easy for you at the moment?
I say it's quite difficult. Well, I say difficult. It's challenging, which is good. I feel like I'm always learning something new. When I started, I didn't know much about paediatric physio because obviously at uni they don't teach you much for paediatric physio. So coming into this role, I've learned a lot, which has been good. I think I'm at a place now where I'm more confident in what I do, but I'm still learning, which is good. And I feel like I'll always keep learning because there's just so much to learn in paediatrics. I feel like it's its own whole group, to be fair. Whereas at uni you do a lot of adults, so I think it's good. It's challenging. I wouldn't say hard, but challenging. Yeah. There's a lot to do.
I imagine so. Do you work in the NHS at the moment?
Yes, I work in the NHS. I work in community. So I work in clinics, I work in specialist schools, I also do home visits. I'm everywhere and anywhere.
Yeah. What brought you to physiotherapy? Why did you pick physiotherapy as a career path you wanted to go down?
To be fair, I always wanted to be a physio. I think when I first heard about physio, it's not what I'm doing now. I think when I first heard about physio, I thought like sports rehab, and I was like, yeah, this is what I want to do. And then, so I done my undergrad in psychology, and then after I done my undergrad, I applied for a role in NHS as a physio assistant. And I worked on a respiratory ward. So I done respiratory, cardiothoracics, cardiac surgery. And then I sort of realised that the role of physio isn't just rehab, but it's like sports rehab, but it's also rehab on wards. It's chest physiotherapy. And I was like, this is really interesting. I want to know more. I just find it so fascinating, the things that physio is done on wards, especially in respiratory, and I was like, yeah, I want to do this. And I also realised in the hospital there's so many other areas that physio do, like surgery, women's health, as well as MSK, and there's obviously community side of it. So yeah, I think I wanted to go into it because it was sort of a more rounded career. There's so many different opportunities that you can go into. So then I applied for the masters. So yeah, I more went into it because of my role as a physio assistant is kind of why I went into it, and I enjoyed it.
And and what drove you into the world of pediatrics or neurology?
I always loved working with children, so that's what drove me into working in pediatrics. And whilst I was at uni, unfortunately, I didn't get the experience of having a pediatric placement. But I sort of wanted to know what paediatric physio was like, so I basically ventured out and found some days shadowing at a private physio clinic, and I also done a day with another private physiotherapist doing paediatrics, just to see like what sort of things they do, how it's different to adults, what sort of treatment that they do, and what sort of rehab. And also, whilst I was at uni, there was a guy that came in who spoke about paediatric physio and what he does, and I was like, this sounds like what I want to do. So when I came out of uni, I was like, I'm going to apply for a paediatric physio job, and I'm just going to see how it goes, and hopefully I'll learn a lot. And honestly, I'm so glad that I did stick to my guts and went with paediatric physio, because I really enjoy it. I love working with children, and yeah, they can be very motivating and just lovely to work with.
Yeah. If there was any other area that you look at apart from the pediatrics, are there any other areas that interest you in physiotherapy?
Yeah, I've got quite a few interests in physiotherapy. I quite enjoy women's health. I also enjoy respiratory. Love respiratory. I just feel like those two areas can make impacts in people's lives. I think all areas of physio is actually really good, even orthopedics. But yeah, I'd say my other areas would be respiratory and women's health.
Sure. And am I correct? Are you rotating as a physio, or are you static at the moment?
No, so I'm static. So yeah, my role is purely Neuro Paediatrics.
Is there a reason you didn't go down the rotational route, or is there a reason you picked static?
I wanted to go static because I kind of knew I only wanted to work in paediatrics. I think it's good to go down the rotational route if you're not really sure. But I think being on placement, I went through different roles, and obviously before I was a physio assistant, so I kind of felt like I had a range of where I kind of wanted to go. So yeah, I think from that I was like, I want to do paediatrics. But I think the good thing about physio is you can always change. So even now, even if, for example, I want to do rotations, I've always got the option of doing rotations, but I just wanted to have that experience to do paediatrics first, yeah.
And has all your professional experience been within the NHS?
Yes and no. So yes, I was working as a physio assistant in the NHS, and then now I've worked in the NHS. All my placements were NHS. However, now I also do bank shifts at a private hospital. So that's doing elective orthopedics. So I've got a bit of experience doing private.
Yeah. In your own terms, how have you found the experience of working in the NHS? Good, bad, medium experience, or anything complex?
I think working in the NHS is good in terms of it gives you quite a lot of experience. I think you're well supported. I think in terms of career development, there's always opportunities for you to do courses. There's lots of training. Like I've had so much good in-service training on my job. And I think that's the benefit of working in it. There is so much training, and they are very supportive in terms of your development and increasing your knowledge.
And has there been any negative experiences you've had in the NHS generally, or has it mostly been positive, as you mentioned some positive ones now? I feel like everyone has the same thing to feel negative experience working in NHS is just the workload and the demands of the NHS and just staff. I think staffing is the biggest one at the moment, and I think you kind of just feel it all the time. It's just staff shortages and people burning out. I think that's the only negative bit about it. Yeah. Okay. How have you found the transition from being a student to being a full qualified autonomous practitioner now?
I think it's quite difficult for me because when I started my degree, so I'd done a master's, and I done it sort of the year of COVID, so I didn't get much lectures, and yeah, I didn't get much lectures, but I think it also helped because I was a physio assistant before, so I had some experience working in hospital, so that was good. So I think that kind of sort of set me up, and then also my placements also set me up. But then in terms of my actual job now, I think the transition was quite difficult because they don't teach much of paediatrics at uni. So I think that transition coming into being a qualified physio, I think at the start I was a bit like, oh my gosh, what am I doing? Am I like way out of my depth here? But I think that is a good thing, because they don't teach at uni. I think most people know that they don't teach at uni. So my team were really supportive, and they're like, yeah, like we've all been there. We know that they don't teach much of it at uni. So they're kind of teaching you kind of from scratch. So in that sense, it was good, going from being a student to, yeah. I think also my last placement, I was quite autonomous on my last placement anyway. And that's quite a lot of feedback that I got with the people I worked with, were like, they felt like they were working with a band 5 physio already. But that was mostly because I had a bit of experience before as well, so it made it a little bit easier. So yeah, I think the transition's been quite different, and also because it's been a community. So I work in community, so I think that transition's been very different, trying to balance a different type of working, and trying to balance my own caseload and things. I think community is actually pretty good in a sense that it does make you pretty autonomous, because you don't have, like, you kind of have to rely on yourself. Like, you have to rely on yourself to make sure that you get the work done. You have to plan your own time. And yeah, you just have to make the most of the time that you have. So in that sense, yeah, uni didn't really set you up for that as well. So I kind of had to learn a lot. I've learned a lot. I'm still learning.
Yeah. And you touched on the gap between you. Would you say there is a big gap between what you get taught in university versus what you are asked to do in practice?
Yeah, because like when you're at uni, you work on your friends. Everyone's got mostly normal range of movement. No one's got tone. For example, I do a lot of pediatrics, so these children have a lot of like tone and contractures and things. And when you're at uni, you don't ever see that. And also when you're at uni, you because you do it on your friends and stuff. When you're in practicals, you don't see a lot of people that are non-verbal. So obviously I treat a lot of children that are non-verbal. So I think in that sense, yes, it's been very different, and it's obviously children, whereas I've done a lot of adults whilst I was at uni. So yeah, very, very different, and in terms of what they teach as well. Yeah, so when they teach you at uni, they kind of do it in a systematic way. Like, this is what your assessment should be. And yeah, I think you kind of follow that, and then whilst you're on placement and stuff, you kind of go through that systematic process, and then when things don't go that way, you're a bit like, oh no, what do I do next? So in that sense, yeah, I think uni should be a bit more, I don't know, I think they should sort of do scenarios that are a bit more unpredictable, and they should sort of throw in things here and there to kind of throw you off, because that's what happens in the real world. Things don't always fall in to this process that you get taught at uni.
Yeah. What about your placement experience? How were those? How did you feel those prepared you for being a physio?
To be fair, I thought my placements were pretty good. They set me up for working. So my first placement was in mental health. And I think that sort of showed me an alternative way of working, because not many people have see physios in mental health. I had trauma and orthopedics, care of the elderly. I had a community stroke placement. I had a women's health and MSK split placement as well. I think those were my main ones. So yeah, I think in a sense that did set me up more, the community stroke one. Also because I work in the community now. I think the other ones, I think if I worked in an inpatient setting, definitely those placements would have been beneficial to me working on a ward.
How would you say, what value would you put on your team's support? Because that's one thing a lot of people say, is either you get a very good team that's very supportive, or if you get the opposite in high demanding areas, it might be tricky for that team to support. What value would you put on that? To be fair, I think, yeah, your team is the biggest thing. I think without having such a supportive team, I don't think I would be
in the place that I am now, especially because it is in the community, so you don't always have people like on a ward where you can, I don't know, go and ask someone straight away if you need help. So I think having a good team makes your experience. I think when they're really supportive, you're in an environment that you feel like you can ask them for help, you feel like you can grow, and you feel like you can sort of lean on others if you need it. So I think that helps. I think if you have teams that aren't so supportive, I think it can sort of stunt your growth. And I also feel like you can also fall into making mistakes quite easily, because then you're not in a safe environment to feel like you can ask for help or feel like you can ask for help. So I think that's quite beneficial in having a very supportive team. It's really difficult because you can't really choose your team. That's the only thing. But I think, physios in general are always all the physios I know are pretty nice and supportive people anyway. So I've never really had any issues there.
You mentioned about your perception of being a physio. What do you think at the moment? Do you think the public's view of physio is fairly up to what physios actually do, or do you think there's a disconnect between what people think physio is and what physio actually is?
I think there's a disconnect, actually. I think a lot of people think physio is just the rehab side of it. I think maybe more recently people are starting to be a bit open to that there is more to it. And even like when I talk to people, I tell them I'm a physio, and I like sort of tell them that there is other areas of it, like falls prevention, there's like bone health, and all these other areas. They're a bit like, oh wow, like they didn't know that this existed. I think there needs to be more done for people to know that it's not just sports rehab. Like there is the respiratory side of it, there is neuro side of it, there is like the women's health side of it. There is so many different other areas to what physios do, and even like in terms of research as well. There's physios that do that. There's also you get independent prescribers. I think people sort of just put us in a box of just rehab. And even the rehab side of it is not, I think not many people know that there's physios that work in hospitals that help people to be able to like do sit to stands, to transfer, that we also do equipment as well. So yeah, I think there's a disconnect there.
And what do you think can be done to bridge that gap between the public?
Not sure. I guess just sort of, where you can just educating people on maybe what we do, educating people on what is out there, what sort of conditions we work with and how we treat them. I think that's quite good, because even like sometimes I used to put things up on like my Instagram, like just like mini case studies, and like sort of put like pictures from like Google and stuff of like, or videos of like how you treat a certain condition, and people like, oh, like I didn't know that was a thing. So I think in that sense it's just trying to get the information out there and make people more aware of how we can treat people and the different ways that we do it.
And you grew up and you studied secondary school in UK, am I correct?
Yeah.
Did you know much about physio when you were at that stage?
No, I didn't actually, honestly. I just thought it's just sports rehab. I didn't know much about any other, if I'm honest, I didn't know any other areas of physio existed. Yeah, not at all.
Yeah. And what other professions were you marketed or were you exposed to more, or were you guided towards when you were doing A-levels and secondary school?
I think in secondary school, I only really knew about, I guess, doctors, nurses, radiographers to an extent, and that's probably about it. Honestly, I did not know much about speech and language, dietitians, like, there's just, I didn't know much about any of them. I knew a bit about occupational therapy, but I think that's only because I knew someone who was an occupational therapist. I felt like if I'd probably not known her, I'd probably not have even heard of occupational therapy either. And even that, people still even get occupational therapy and occupational health mixed up. So, yeah, I think there's not many people know about all these other careers out there. Even like art therapists, there's like so many different careers out there.
Yeah, that is very true. There's not a lot of AHP drive, or so what I've heard in when people are studying. So a lot of people go through different routes. What was the initial route you went down before doing the master's in physiotherapy?
So I done my GCSEs, went to college. I done media, graphics, and sociology. And then I done my undergrad in psychology, and then done my master's in physiotherapy.
Do you think that psychology undergrad helps you as a physio, or does it not play a big role?
Yeah, I think it does, definitely. In terms of people's motivations, in terms of getting people motivated, and I think it also helps in terms of understanding people. I think it helps you look at the psychosocial aspects of people. I think especially on wards when there's other things going on, and as a physio, your job is to get them out of bed. And I think trying to look at their motivations and just sort of looking at things from the psychosocial aspects of their life and everything else that is going on, I think that helps as well. Just understanding people's behaviours, definitely.
So we're coming back, and we're going to move the conversation slightly to a different direction, which is more about you as a Black woman. Do you feel that being a Black woman plays any role in your healthcare or NHS experience, positive, negative, or medium?
I think it plays a role in terms of, I guess, in terms of maybe other, like the younger generation, I guess, seeing that there are Black physios out there. I think also when I was an assistant, I also saw that there was there was probably like one or two Black physios that I used to work with. And even in my job now, I'm actually the only Black physio in my team. And I think it's something that I noticed when I did start. I think it sort of it plays a role in terms of that. To be fair, whilst I was actually at uni, I was on a project that was about racial inclusivity within physiotherapy practice educators, and I think that sort of also opened my eyes in terms of practice educators and the effects that they have on people from ethnic minorities. And I think that was quite intriguing, but I'm kind of glad that I'd done that, and hopefully that will have an effect on practice educators and treating physios that are coming up with ethnic minority groups as well.
Why do you think that there are not that many Black physios?
Honestly, I actually don't know. And it's a question I've actually asked myself quite a few times. I don't know if it's just not intriguing to them, if it's just maybe there's not many around, or if it's maybe they've just not had the exposure to it. I'm honestly not sure, but it's a question that I do ask myself quite often, and I'm not sure, because you get so many Black nurses, healthcare assistants, but not many Black physios, to be fair, or occupational therapists. Actually, I think you get more occupational therapists, but I don't know.
Both are still you don't see as much. That's fair enough. And in university as well, you mentioned this project you were on. Can you tell us a bit more about it?
Yeah, so it was with a few lecturers. It was with other like physios from other ethnicities as well. And it was basically we created a resource that looks into experiences. So this was based on a previous study that was done by, I think, a few physios, and the research kind of turned out to be that it was research that was based on interviews. So these physios interviewed other physios on their experience of placements and how their practice educators treated them based on their ethnicity. So we basically created a resource that would kind of inform practice educators on the experiences that ethnic minorities do go through in order to sort of give them more insight so that their behaviour would hopefully change towards any students that they have. Basically, yeah, it was a higher education resource.
Okay. And would you take the outcomes of that as good, bad, medium?
Yes, I think it's a good resource. Obviously, I haven't seen the effects of it yet because it's still in its final stages. So I think I'm sort of just waiting to see what the effects are, but I'm hoping they'll have good feedback on it. But I think it's a good place to start.
What was your experience as a student on placements? Were they all good, bad, medium? Do you feel your race had played any role or not?
I had all good experiences on my placement. My first placement was actually really good in the sense that the team that I worked with, I think the band 7, the clinical lead, he was Black. The people in the team, like I had people in the team that were Asian, that were Black, and it just made me feel like, I think it made me feel really comfortable. And I think because also when I went to uni, it was a predominantly white area, so where I went to uni, I was kind of not expecting it. So when I had my first placement, I was like, oh, this is nice. And I just felt a bit more like it was nice because I felt like they could relate to me. I was able to like speak about things that they understood. And I think in that sense, it was quite good as well. And even like my educator on that placement, like she wasn't Black, but she also she kind of understood, and she was able to speak to me about different things as well. And I just felt like it was a nice placement. And I think also one of my other ones, they had quite a lot of Black people in that team, like a lot of Black nurses. They had like Black consultants. I think it's nice having other people like you around. I think it just makes you feel a bit more comfortable in that sense. But even in my places where there wasn't as many, I still felt really comfortable. Everyone was really nice. Had no issues. Yeah.
Interesting you mentioned that. Do you feel, so I get the idea, do you feel you had to have had Black people within your team, or do you feel you could have it either way and you still be all right? What do you think?
I feel like I could have it either way and still be fine. Yeah, because even now I'm fine, even though there isn't any. I think it's just the people in general. I think if they're really nice and open, I think regardless of where they're from, I think it's fine. But it's sometimes nice to have people to relate to and talk to certain things about. But even some people can be really open regardless anyway.
And now that you are fully qualified, your experience in the NHS, you've alluded to it a little bit as a Black physio. How has it been? Do you feel like your role has played any role, or do you feel that you were able to just get your job done without considering it much at all?
I feel like I'm able to get my job done without considering it at all. Yeah, I think there are certain times that things like hairstyles, because I change my hair quite often. I think in terms of that, sometimes like people, it might not even be necessarily like people that work with, just I guess maybe like families or other people that always like, oh, like your hair's really nice, your hair's long, and oh, you've got new hair, and like things like that. I think it's like just the little things that sometimes I'm like, oh, they're not really aware of braids and extensions and things like that. So I think in that sense it can be a bit not difficult, but it's just that little thing. But in terms of actually getting my job done, I've not had any issues being black. Yeah.
Have you found it your future in the NHS or in healthcare profession? What are you looking forward to the most?
I think I'm just looking forward to just expanding my knowledge and just being really confident in myself and my skills and my ability, and just just expanding and doing more. I would like to get into some research. So I think just looking for those opportunities at the moment.
Yeah. How well supported do you feel you're able to get in that direction? Do you feel you'll be generally supported well enough?
I'm hoping so. I'm actually moving trusts soon, so I feel like if I stayed where I am, definitely. But I also don't know from where I'm going if they're going to be as supportive. But I'm hoping that they will in terms of my career development.
Fantastic. Is there anything else you want to leave the audience with before we sign off?
No.
Thank you very much, Lynn, for coming onto the podcast /video.
Thank you for having me.